So, for all of you guys out there wondering what we do at work, this is what we do. We doodle on each other. Doodle on each other. Actually, what Car's doing, Car's actually doing, I'm going to say, what is this, Car?
I'm marking the area.
Okay.
Right now I'm looking for where her mandible bone is because we don't want to inject there.
Right.
And now I'm looking.
Okay. And for those who would ask, why don't you want to? What could be some problems that can... And so what is this then, Car?
This is the dot grid
Okay.
to help us determine where we're going to inject.
Okay. And can you explain to me exactly what Kybella is for?
So Kybella is good for submental fullness, and what that means is just kind of excess fullness right here underneath the chin area. Chelsea's actually a great candidate for it. So what we've done is marked her, so this kind of tells us where we're going to be injecting. We want to try to stay away from any major nerves in the area, so that's where we have this a little bit of this injecting pattern. The dots just tell me where I'm going to actually inject the medication, and then the rest of this, we can actually clean that up because it's not going to be relevant. Mm-hmm. So this kind of gives me a guide point of where I'm going to go inject, but for the most part, even just looking at Chelsea, especially when she's sitting up, it's pretty easy to see where we're going to inject the medicine. Once we're done, she's going to see that she has a little bit more fullness in the area, and that's normal. That can last for anywhere from a week and even sometimes up to 2 weeks as well, too.
And that's the swelling after the injection?
Correct.
Okay.
So first we're going to numb her so she doesn't feel the burning part for the Kybella injections, and then we'll start with the Kybella injections as well. All right, Chelsea, you ready?
Mm-hmm. So the good thing about the anesthetic is that it pretty much sets in right away.
Do you feel anything, Chelsea?
I don't.
And this is something that you do for every patient, correct?
Yes. The medicine itself will burn quite a bit, so hence the point behind doing the anesthetics. And once we start injecting her, most of that burning goes away. How are you feeling, Chelsea?
Good.
So when would you say that she would actually start seeing results after the Kybella injection?
So usually it can take up to a month. Sometimes it can go up to 3 months to see the results. But for Chelsea, what we'll probably do is do another session actually in a month,
Okay.
and then that'll help us kind of get her better results because most people need at least on average 2 treatments.
Okay.
Okay, you ready, Chelsea?
Mm-hmm.
If anything burns, let me know and I'll put more anesthetic in. Okay.
And this is the Kybella injection, correct?
This is.
Awesome.
This is super easy. Areas as well too, so I'm sure in the coming months to coming years we're going to find that we're going to be using it for other areas other than just the chin.
And so this is the second syringe?
Correct. So usually most patients will use 2 vials, which is 4 syringes.
Okay.
So she's not. How are you doing, Chelsea?
Good.
That's Kybella. We're done.
Wasn't bad
Wow.
at all.
It's super easy. Now we're gonna get her cleaned up,
Okay.
and then hopefully in a month we can show you pictures on what she looks like from before and after, right, Chelsea?
So other than swelling, what should she look out for?
Swelling's gonna be the biggest thing. She may have a little bit of bruising, especially from the anesthetic that we put in.
Right.
But other than that, she should be good.
That wasn't bad.
At all. You did good.
Thank you.
Chelsea was petrified to get the
Yeah.
injections.
We kind of cheated, didn't we, Chelsea?
All right, well, let's get you cleaned up and we'll get you out of here, okay?
Thank you.